Good afternoon, good evening. It's my pleasure to chair this meeting. Webinar is a very easy way to connect the world. I am Jean-François Rey, working in France. I'm a former president of a World Endoscopic Organization, and I've been involved in the development of capsule endoscopy for more than 20 years. Webinar, it's a nice opportunity to meet, but also I should remind you, next month we have a World Congress in July in Seoul, organized by W. Small bowel endoscopy had been quite development for last 20 years. Until early 20s, without capsule endoscopy, the small bowel was really the black box of the digestive tract because it was very difficult to assess, to diagnose, and to treat. And thanks to the development of capsule endoscopy, we were able at that time to discover a lot of pathology in small bowel. But it's also important, at the same time, in Japan, Professor Yamamoto developed the double balloon enteroscopy, and some colleague in Japan and myself, we developed a single balloon. So capsule endoscopy is really the first step for small bowel, and with the double balloon, single balloon enteroscopy, we are able to treat. What is important by the time being is to see the improvement of the technology. Technology of a capsule, technology of all this part of this examination. But also now we have to face the involvement of artificial intelligence in the capsule reading. We also discover what is going on in China, because it's very strange. In Europe, in America, in Japan, we develop, of course, the small bowel capsule endoscopy, and then we develop the colon capsule endoscopy. But at the same time, in China, they are developing since last 10 years the guided gastric capsule, which is very popular in China, and we'll see what is a new possibility for diagnosis with this guided capsule. So for this seminar, we will cover the new technology, we'll cover colon capsule, and we talk about some new possibility for diagnosis of capsule.